I'm Christine Koth, holistic physical therapist.
And I'm Mariah from Pain Free Fitness.
And we're here to look at Mariah's hip and see what's going on. So she's been super excited to try the hip hook.
Yes.
And is really curious whether or not this would help her. Mm-hmm. So if you wouldn't mind sharing a little bit about what's going on with your hips and what you're feeling. And then we can just kind of see if we can figure it out.
Yeah. So I think an important note is that I have a lot of skeletal abnormalities in that area. So that will be just something to keep in mind. But I've already had surgery on my right hip for femoroacetabular impingement. Mm-hmm. So I pretty much had the joint just kind of reconstructed. Like they had to shave back the bones in there and everything. Lots of fun. And then on this side, around the same time, I had a really big inguinal hernia. So I know I've got some scar tissue in there and all that. Mm-hmm. But in the last probably year and a half, I started to feel what just kind of started feeling like a tightness in this hip joint, which is not unusual. I kind of, wherever my pain is, it just kind of bounces around. So I was like, meh, it's fine. And it's been getting gradually, like really slowly worse. And now I'm starting to show some more symptoms of maybe hip impingement. I'm having some pain when if I'm under load and I like lift my leg up, and I just kind of feel tightness in there all the time. And it's very, very apparent. Like I can feel it right now, just kind of sitting in this position. Mm-hmm. So I'm just curious to see what's going on in there. And I have not seen anyone for this. So yeah.
Is this, so you mentioned the hernia on that side. Mm-hmm. Tell me more about that. Did you have that repaired? Okay.
I did.
So they put a mesh in?
They did.
Okay.
Mm-hmm. Yeah, and that was probably 7 years ago, something like that. So it's been a while.
Okay.
And I haven't had issues with it since, but I'm sure there's stuff pulling on other stuff. And
right.
Yeah.
Okay.
Mm-hmm.
So with a hernia, we do need to be careful about poking in there.
Sure.
Because you have had surgery, so we'll be cautious about that when
we
look at that.
Yeah.
And also caution with using the hip hook with something like that too. You want to make sure that you're using it correctly and putting it in the right spot when you have had a surgery like that.
Yeah.
Okay, why don't you go ahead and lie on your back.
Okay.
We're just going to take a look at... Now this side's been fine, or been feeling fine?
Pretty much,
okay.
Yeah. I do have, so you'll probably feel, but I've got a little bit of scoliosis, which makes my hips kind of tilt. Okay. But other than that, no pain.
Okay. So I'm just feeling the muscles and just seeing what feels tight, what feels loose, if there's asymmetries. So I just pushed on her iliacus.
Oh boy.
There. This side, wow. Sorry. You actually have your right side feels more squishy than your left side. And now I'm getting down a little bit to where the psoas and the iliacus join. And there's a little bit of tension in there, but the iliacus feels really inflamed, especially on that one side.
Yeah.
So let me just see if that's affecting your alignment, because one of the things that can happen is that if you have tension in the iliacus, it can cause your pelvis to rotate forward, which then can make the available range of motion less, which can cause more pinching. So if you're noticing like your hip is pinching, and I talk about this in my book a bit, that can be a cause.
Got it. Okay.
So I'm just going to do this test. It's called the supine to sit test. So basically I'm looking at your leg length here to see if one leg is longer than the other when you're lying down. And they look pretty equal right now. And can you keep your legs straight and sit up? And so this foot got shorter. So that's an indication, if you go from some distance to something shorter, that the pelvis is rotated anteriorly, which is another indicator that the iliacus would be involved on that side.
Got it.
Okay, so go ahead and lie down. This is easy, not having a treatment table. I can just stand over you.
Oh boy.
Yeah. I'm just going to take a peek at your belly. Okay. So in your case, you definitely have tightness in your did you see her face? In her iliacus. Yeah, right there.
Yep. Hello.
So like I mentioned before, so this is the hip hook. So this is a tool that I designed that works specifically to get at this muscle. Now, most tools that we use go directly into the body. If you lie on something, it's going to push directly in. But as you can see, in order to get at the iliacus, I have to push in an angular direction. So for manual therapists that are working, like massage therapists or physical therapists, whoever's working manually, you need to kind of get into the inside surface of the pelvis and push inward. I don't know if you can zoom in on that a little bit, but push in this direction. And so the hip hook is designed to let someone do that themselves, on themselves. And the way that we do it is through pivoting the tool. So I'm going to have you lie on your side.
Okay.
I'm just going to have her do a little demonstration here. So scoot back a little bit. So when you're using the hip hook, you're going to find your own pelvic bone at the front of the hip here. So go ahead and put your hand there and feel that bone. And it's right inside there in that direction where the iliacus is. Yep, exactly. So if you hold the handle of the hip hook and you place the tip right on the inside of that bone, that's going to get at the iliacus. So now what you're going to do is you're going to roll over onto your stomach so that this is flat underneath you.
Okay.
And then let your body, you can relax your hand and just relax for a second. Yep. She's so excited. I want to grab onto it. So just let your body sink into that first and get used to it. Now, the first time you use this tool, this is an area of the body that hasn't ever been pressed on before, probably. So I recommend that people give it maybe 30 seconds just to let your body sink into it and let that first initial pressure, which is usually on the psoas, kind of melt the muscle a bit. And we're using a technique called prolonged pressure to deliver sustained pressure, not moving it around, not a lot of mobility, just holding pressure, which causes the brain to learn to let go of tension. So now that you've been on it for a little bit, now you can push on the lever. Okay. So as she pushes on the lever, it's causing the tip of the hip hook to push onto the inside surface of the pelvis. How does that feel to you?
It's very painful, but in a good way, feels like it's doing something. I'm a huge baby and I never work on my own psoas or iliacus, so this is a good thing.
Well, the neat thing about this too is it's using a lever, it's using your own body weight, so you can relax into it as much as possible.
Yeah.
You're just lying down, you're letting the tool do the work. You can also even just lay your hand on top of it. It's even a more relaxed position.
Mm-hmm.
I like to grab onto it like she was, but there's different ways to do it.
Oh yeah.
But it's just creating a little bit of a rotation, so that tip is now going to the inside surface of her pelvis where that tightness was. So let's just give it like a little bit longer. Is it starting to dissipate or starting to get a little bit less?
I think so, yeah. It's kind of, it's like coming in waves a little bit.
Mm-hmm.
Is there anything, like I know when I do soft tissue work on people, there are some areas where there are a lot of nerves and things like that we want to make sure we watch out for, like tingling and things like that. Is there anything in this area that you find to be problematic?
Sometimes with the ball.
Yeah.
The ball, you want to hand me the ball? So the ball that I recommend for psoas release, that will press a little bit more medial, like towards the center of the body.
Okay.
And that can press sometimes on the femoral nerve.
Okay.
And so people will notice like the front of their thigh, maybe feeling a little bit numb. So if that's the case, you just, stop and move it to a different place, and it should immediately, dissipate. If you were using this and you were feeling that same sensation for some reason, or any tool for that matter, anytime you generate some sort of numbness or tingling sensation, it just need to move it a little bit so it's not pressing on that nerve. Now there is the part of the body. Here's my little skeleton. So this is the iliacus that we're working on. Here's the psoas. This part here is called the inguinal line. There's a big ligament that is there, and right through this little passage in our body is where we have some blood vessels and nerves going through. So I don't recommend people put the hip hook or the ball low lower down, which would be basically at the crease line of the hip.
Mm-hmm.
So this is too low. You know, working in this region is too low because there's a good chance that you'll hit a blood vessel or a nerve. That's why we want to go up here where she is, the inside surface of the pelvic bone. So more in the soft area of our abdomen, right inside this bone, not down here.
Got it.
How's it feeling now?
Good. Yeah, a lot better.
Okay, so why don't you go ahead and release the pressure of your hand. You can go ahead and roll back onto your side. Coming off of it is always like, oh!
Yeah.
But let me have you lie back on your back and let's just retest you and see if that did anything. So sometimes just releasing the tension in that muscle will help align the pelvis. Sometimes you need to do a realignment exercise to help facilitate that afterwards. And I talk about that in my book as well. So you're still equal when you're lying down. How about if you sit up and see what happens? Yeah, so you look equal.
Okay.
You look
Nice.
equal now.
Yeah.
Why don't you go back up into that position you were in, kind of kneeling on your knees, and you were feeling a little bit in your hip when you were there. How's it feel?
It's definitely better. That I don't think I've ever worked on my iliacus before, so it's like there's like a soreness,
Right.
but it's not the same tightness that I was feeling, you know?
Mm-hmm.
Yeah.
And this, you know, if you've been holding tension in this muscle
Yes.
for decades, right?
Yes, probably.
It's not going to go away overnight.
Right.
However, and it is going to be sore.
Yeah.
Because it's the muscle that it's been angry for a long time. It hasn't been touched. It hasn't been worked on.
Yeah.
So it's to be expected.
Yeah.
Usually what I recommend when people start with this tool is they do it for a couple of minutes and then they wait a day or two to let that soreness dissipate and then go back in. And you'll get to a point where your body will just welcome this thing and you know, it actually feels really good. It takes maybe 20 seconds and you're done.
Yeah.
And, you know, it really, your body learns to respond to it. But initially it's something new and you have to be kind of kind to that muscle that's been.
Yes. Yeah. And I think also just like assessing what kind of soreness or pain it is, because what I'm feeling right now is very different than what I was feeling 10 minutes ago. You know what I mean? In a good way.
Yeah.
So I think it's, it's just really cool to see how fast that can work. Yeah.
30 to 90 seconds is really all
Yeah.
you need to get it to chill out.
Yeah. Yeah. And up until now, it was like, you know, you lay on your back and just dig your fingers in there by yourself, and that's not any fun. So this is like, it's just nice to have something do it for you.
Yeah. One of the things I found about this too is you can't get the right angle and enough pressure.
Yeah.
And you can't sustain it.
Yes.
You know, it's like your hand starts to quiver. It's kind of an awkward position.
Yeah.
And then, you know, we don't want to end up with wrist injuries or, or having a shoulder problem as a result. So we want to be safe in how we're using our body.
I love that. Thank you. So 30 to 90 seconds and then like every other day you recommend? Okay.
Yep.
Nice.
Yeah. And once you get to the point where that muscle has learned how to relax and stays relaxed, you know, then it's just a maintenance thing. You know, maybe you do an activity like you sit in a car for a really long, road trip or something, and then you notice that you're feeling tight in your hips, and you can use it, you know, when you need it. You maybe once a month or once every other week, or you know, as part of your maintenance program.
Okay.
You know, but the first few weeks, you know, you want to give it a lot more attention.
Awesome. Thank you so much.
Yeah, it's my pleasure.
I'm a big fan. I'm a fan already. I can't wait.
Awesome.
Thank you so much.
Yeah.